Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. Thank you for tuning in today. We're kind of in the middle of a little series that has evolved from the top of the news story a couple of episodes ago, where I reported the results of this really exciting study that showed that coffee has tremendous benefits for reducing risk of cognitive impairment and heart disease and a host of other conditions. You'll still continue to hear stories in the regular press that says one day coffee's good for you, the next day coffee's bad for you, and tea, the same thing. It's in the medical press. It's clear. Coffee is good. Drinking two or three cups of coffee a day, 1 or 2 cups of tea has tremendous benefits. You will be healthier if you drink a couple of cups of coffee or tea a day versus someone who doesn't drink any coffee or tea a day. And that is partly because of polyphenols and other antioxidants and other nutrients in coffee and tea. But this study that I reported a couple episodes ago is also really exciting because it showed the benefits of caffeine itself in tea and coffee. The caffeine in tea and coffee, they proved that was a standalone benefit because when they compared people who drank decaffeinated coffee and tea, they did not have the same reduction, especially in incidence risk of Alzheimer's, dementia, cognitive impairment, early signs of any kind of dementia. So that's really exciting. That led me on this whole discussion, which recurs frequently because one of the most common things that people come to me for is fatigue. Tiredness, lack of energy. Pick your favorite term. Clinically, the solutions, I'm not fatigued. Some people say that, I'm not fatigued, I'm just tired all the time. Or I just have a lack of energy. Well, the solutions involved in treating all those things are the same. So, pick the phrase that works best to describe. I want to hear what best describes what you're feeling. But just know that the solutions for fatigue, lack of energy, and tiredness are all the same, even if they feel a little bit different. So last week we talked about insufficient protein and chronic subclinical gut infections. What does that mean? So chronic means something that's been there for a long time. Subclinical means it doesn't show up on a standard medical test. Gut obviously means it's happening in the intestines. The most common cause of any kind of chronic, low-grade, long-term infection in your intestines, in your gut, is lack of sufficient hydrochloric acid in the stomach. So please refer to the previous episode where we talked about that in detail. We're going to move on. I'm doing this so that the article about caffeine was really exciting because no article has ever come out that has been this detailed and far-reaching in terms of the number of people it studied over 43 years. I mean, this is pretty definitive. Thousands of people, tens of thousands of people studied over 43 years, proving that people were healthier, especially in reducing risk of dementia, but also indications for less risk of heart disease and a few other conditions by consuming a couple of cups of coffee or tea every day with caffeine. So that launched me on this review of the 12 most commonly overlooked causes of fatigue. I created a special website just to answer questions about this. I invite you to come check it out. It is called FatigueFreeLiving.com. FatigueFreeLiving.com. Check that out for more information about the 12 most commonly overlooked causes of fatigue. Why do I pick that phrase specifically? Because there's lots of causes of fatigue. People come in, they want to know the one cause. I'm exhausted all the time, and last week or last month or last year I felt just fine. So something must have changed, and it has to be one thing because it dramatically changed on August 14th, whatever year. Nothing in your body works like that. Symptoms start that way. And so, I get it, when you're feeling fine, then one day you wake up and something's not feeling fine. Obviously, something must have happened that day. Well, the thing that happened that day is kind of like the straw that broke the camel's back. You just finally reached the threshold where you feel the symptoms of most of the time, especially if it's related to fatigue, of something that's been brewing for years, decades even. And you might not want to hear that, but if you want a solution, if you want to figure out a way to resolve something, if you've been, who do you know that is feeling exhausted for no reason? They're perfectly healthy. You eat a great diet. Your sister, your brother-in-law, your mother, your kids, your neighbors, they're jogging, they go to the gym, or they're, happy, healthy, fit. Everything's going perfectly. They have an amazing life, but they feel exhausted for no reason. Why do they feel like that? Last week, last month, last year, they felt fine. Nothing's changed. And they still feel they get up and it's really difficult. They have to drink more coffee. They have to do something just to keep their energy up. Why? Why is that? What is that one thing that changed? Well, it isn't one thing. It's never one thing that changed. It's a whole bunch of things that have been festering under the radar for months, sometimes years even, that you don't feel until one day you feel the effects of something that's been festering for a long time. But those things are, you don't have to, it's okay. Send them to me. Tell them to text me. Email me at drbinkley@binkleyhealingcenter.com. Tell them to text me at 805-218-3939. How do I give out my cell phone on the radio without being inundated with spam messages and other things like that? Well, it's very easy. I never answer my cell phone. That phone, the ringer on that phone is always off, but I'm happy to field your questions. If you text me, I'll respond as quickly as I can. If you email me, I love responding to emails. If you leave a voicemail, you can call that number and leave a voicemail, and I'll get to it eventually, but it's much faster if you leave a text, and including a text that says, please call me. I'm happy to talk to you on the phone. The best way to arrange a way for me to talk to you on the phone is to send a text or an email saying, please call me. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. We're talking today about the 12 most commonly overlooked causes of fatigue. We're not going to get to all of them today, so check out that website I mentioned a little while ago, fatiguefreeliving.com. We're going to move on now to subclinical hypothyroidism. Well, you've heard of hypothyroidism, but what does subclinical mean? That means you or someone you love, it's much more common in women. Something like 40-50% of women over 50 that I see have some form, especially subclinical hypothyroidism. So subclinical means they go to the doctor, they go to the regular doctor for annual physical, they go to their endocrinologist or gynecologist or whatever your regular doctor is. For some woman you love, your wife, your sister, a really good friend, they go to the doctor and they say, oh no, your thyroid's fine. But they have low energy, weight gain, puffiness, hair loss, skin irritation, a whole host of things that some people are familiar as signs and symptoms of hypothyroidism. But you go to the doctor and they just test one thing, TSH. TSH stands for thyroid stimulating hormone. It's a really great test. It's not a thyroid test. Thyroid stimulate. How's that not a thyroid test? Well, thyroid stimulating hormone is produced in the pituitary gland. It's a very accurate, very sensitive test. If your thyroid is low, your pituitary will usually produce more thyroid stimulating hormone to stimulate your thyroid to produce more thyroid hormone. And that's why most doctors only do that test. And if it's fine, they say you're fine. Well, that's a lie. If your TSH is normal, that does not mean that you don't have hypothyroidism. Number one, because the ranges used for medical tests, all medical tests, are broad ranges. Stretch your hands out as far as you can. This is the way I always do it when I'm speaking in public. I stretch my hands out as far as I can with my fingers pointing straight up. Imagine that, to show you how wide these broad medical ranges are to determine whether or not you need medication today. They're not going to put you on Synthroid, levothyroxine. People say, what thyroid? There's only one thyroid medication for low thyroid. It is levothyroxine. The brand name is Synthroid. That is T4, that is thyroxine. It's basically the only medication there is. There are a few other natural medications which are much better, but that's the one that most people end up taking. So levothyroxine, Synthroid, same thing. So if you take that, number one, your body has to convert that into T3. Synthroid is T4, thyroxine. Your body has to convert that into the active form, T3, triiodothyronine. And the assumption when other doctors prescribe you Synthroid or levothyroxine, they assume that your body will automatically convert that into T3, the active form. T4, Synthroid, levothyroxine, does nothing in your body. It is a carrier version that is circulated, the most prominent form that is circulated throughout your bloodstream, but your body has to take that final step and convert it into T3, and it has to unbind a tiny portion of that T3 from its carrier protein to free T3. So if you have fatigue and you've been told your thyroid is fine, you do not know that that's true. Your doctor doesn't know if that's true unless you test free T3. The active form of thyroid hormone is called free T3. Your body has to convert it from the more common form, and the medication that most people get includes none of it. So years ago, if you've ever heard, years ago, they used to give, before Synthroid was invented and before the THS test was invented, I think it was in the 60s, they used to give women, it's usually most men rarely have hypothyroidism. They can. And I see that. I see it frequently, several times a year, but probably 40 or 50% of women over 50 have subclinical, some detectable level, at a level that flies under the radar of standard medical testing, but will show up on functional testing, have diminished thyroid function, subclinical hypothyroidism. And those women who, if they're just given levothyroxine, will still be low. They will still end up with fatigue. They will still have functional hypothyroidism. A lot of doctors don't test for the antibodies that properly diagnose Hashimoto's. So many women come in, again, it's sometimes men, but usually women come in and they say, oh, no, or I have Hashimoto's thyroiditis. I have Hashimoto's. And I said, well, what are your antibody levels? Oh, I don't know. Well, give me your blood test. They never tested the antibody levels. So Hashimoto's thyroiditis is just an autoimmune condition that inflames the thyroid gland. That inflammation produces scar tissue that displaces the nice, soft, juicy glandular tissue that produces thyroid hormone and causes the thyroid to go down. So an autoimmune condition can also cause the thyroid to go up, which makes things really confusing, which is why you have to do testing, proper testing, and sensitive testing to evaluate the earlier signs of things that you can treat and reduce with supplements. So it's very easy and very effective. I have, thousands of patients that I've treated with just supplements alone to fix their thyroid gland, to get the thyroid gland back up into the normal range. If they're a little bit older, they might need to take that thyroid supplement, one supplement, couple of capsules for a long time if their body's unable to keep up with demand on its own anymore. But what's better, taking levothyroxine for the rest of your life or taking a couple of supplements, a couple of capsules of a supplement that have no side effects and don't increase your dependency for more drugs over the rest of your life and actually work better. They work. That's the most important distinction between the drugs and the supplements, is the supplements enable your body to more effectively convert T4 to the active form, T3, and give you, among other things, the energy that appears to be lacking for no reason. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. Well, what do I mean by almost any health challenge? Well, if you're bleeding, go to a hospital. Most people know this. If you can't walk, if you're unconscious, the obvious things. I mean, if you don't need to go to a hospital, if you don't need immediate medical care for a wound, or basically, if you can walk and you're conscious and you're not severely bleeding and you don't have a raging infection, there's a very good chance with proper testing that I can identify what's causing a condition that other doctors have missed, because other doctors are only looking for the thing that you want. Most of us go to a doctor when we're really in severe pain or having really bad symptoms, and we want to know the one thing But what's the one thing that's causing? Diagnose this one thing, fix it, give me a drug. And if you've already been through that route and it hasn't happened for you, for someone you love, your brother, your mother, your sister, your neighbor, your girlfriend, your son, your daughter, have them call me. Please. There are so many things that can be done that most people have no idea. You're not going to hear about this on TV. Most people have no idea what's available with proper testing in functional medicine, identifying earlier signs of stress on all of your organs and tissues and giving your body the nutrients it needs. Think of your bloodstream as a river of life. This is my favorite metaphor. Your bloodstream is a river of life. Imagine a river, a beautiful river in a high, steeped valley with mountains on both sides, and there's construction crews waiting with their yellow hats and their orange vests and all their tools. They're sitting there waiting on the shores of the river, ready to carry out a construction project. It might be healing and repairing muscle cells in your thigh. It might be healing and repairing lung tissue. It might be healing and repairing your spleen or your liver or the lining of your gut. The construction crews are there waiting throughout your body, ready to heal and repair that tissue all the time. But if you don't have the nutrients that those workers need to heal and repair that tissue, then it doesn't happen. That healing and repair gets put off. This is what most people call aging. If you just throw up your hands and say, well, it feels like I'm getting old, a big part of that is your river of life does not have the nutrients it needs to provide the workers on both sides of the banks of your river of life. And we're talking about cells. Cells on both banks of your blood vessels are waiting for nutrients. They depend on adequate nutrients to heal and repair damaged tissue. That's the normal process of health, of healing and repair. You're a living organism. You're not a machine. You don't need to replace your parts. You're a living organism that has cells that turn over every day. In the case of your intestines and some other parts of your body, every 7 years at the opposite end of the extreme, in your bones and your nerves. But over the course of days and weeks, many of your cells are constantly broken down, broken down and replaced. Your body does not repair anything. It breaks down old cells and replaces them. And nutrients, a steady stream, a very specific, broad range of nutrients are required for that process. So if you lack those nutrients, then it just feels like you're getting old. You're bad luck. Sorry. Oh, for some reason that's not healing. It's not true. You can test for these things. You can identify these lack of nutrients and replete them, replace them, supplement them, and then your river of life is stocked. You can stock your river of life with all the nutrients your body needs to heal and repair itself. And then magic happens. It seems like magic because most people do not stock their river of life with all the nutrients they need to heal and repair. And yeah, you have to, there's no way to tell exactly how many nutrients you need. So what works? Just give it enough. Give it the amount that works based on testing of millions of people. Functional medicine doctors do this every day. What is the level of blood tests that result in people feeling healthy and living long and living well? That's what we call the functional range on your blood tests. It's not a part of standard medicine. It's a narrower range. It's roughly the middle third of standard blood tests. If your standard blood test says you're within range, we'll look at the middle third. And if it's outside that, a little high, a little low, it's probably something that could use attention, that could change your life. Just give it a little bit of attention to make that part of your body a little bit more healthy. It could be the difference between feeling miserable and feeling fine again, finally feeling normal. And how do you know? You do testing. You do comprehensive diagnostic testing with a more narrowly focused range to identify places where your body needs a little bit of help. You can give your body that help with a safe, effective, natural solution like a little bit better food, moving your body a little bit in a way that you enjoy, and supplements. Evidence-based supplements that work over time. How do you know if a supplement works That's a common question I get. The only way, I don't know. I know that I get a lot of patients that come in who I test and I find certain deficiencies and they say, oh, I'm taking that. I'm deficient in B12. I'm deficient in vitamin. You're deficient in vitamin D. I tell them you're deficient in calcium. Oh, I'm taking plenty of that. Where did you get it? Costco, Rite Aid, or some other store. It's cheap. People buy, they think, vitamins and minerals are like chemicals. They're all the same. Doesn't matter where you get them. Doesn't matter how much it costs. Whatever. If the same word is on the label, that means it's fine. No, it isn't. No one assumes that all food is the same. If you buy cheap food, it's as good as properly prepared organic food. So don't buy cheap supplements from stores. The worst thing to buy is a one-a-day multivitamin. One-a-day multivitamins don't work because the minerals are ground up rocks and seashells, and as an example for calcium, the nutrients that your body needs in adequate forms don't fit into one capsule. There will always be one-a-day multivitamins because everybody wants one pill. Just give me one pill. Well, if you know someone, because you're listening to this show, I'm going to assume you're smarter than that. But if you know someone who's not so smart and says, just give me one pill, give them a vitamin D capsule, 5,000 units of vitamin D. That's the one pill that will make the biggest difference in anyone's life. But never take a one-a-day multivitamin. Good multivitamins are 4 capsules a day because the nutrients that are like the ones in broccoli and spinach and kale that your body can actually break down and assimilate easily are bulky. They won't fit an adequate dose, daily dose of magnesium, selenium, chromium, zinc, etc. won't fit into one capsule in a form that your body can absorb. It'll fit in an inorganic form that will show up on the label. And if they test it in a lab, that's in there. They have to test those things to put it on the label, but it doesn't mean it'll end up in your bloodstream. You can see those things on x-rays passing through your gut. The most expensive vitamin you'll ever take is the one that does nothing and just passes through you. To recap, chronic fatigue. On the 12 most commonly overlooked causes of fatigue. Fatigue that people have for no reason. You feel exhausted, someone you love, someone you know. Who do you know that just doesn't feel like they have the energy they should? There's never one cause for that. Everyone wants to identify the one cause. I can promise you, send them to me. I will identify a half a dozen causes of that, sometimes 12 or more causes. Little things. When you address all of them at once, magic happens. Your body, your cells throughout your body are suddenly able to function normally like they used to do when you were a teenager in your 20s. Everything works better, more smoothly, and energy is the result. The perception of good energy is the result because you're fixing chronic gut infections. You're fixing insufficient protein. Even if you're eating adequate protein, you're finally digesting and assimilating the protein you're eating. And among other things, for many people, especially women over 50, addressing hypothyroidism, whether it's showing up on a regular blood test or not. Lots of women, especially sometimes men, have low thyroid. Thyroid is the furnace that drives every other function in your body, makes things burn hotter and faster. It's essential to function if you want to live long and live well and feel strong and have the energy that you should. So who do you know that has something like this, that just not getting the results they want? Have them contact me. Email me at drbinkley@binkleyhealingcenter.com. Text me at 805-218-3939. If you want to talk on the phone, I'm happy to. Just expect that I won't answer the phone when you call. Please just leave a text message or an email saying, please call me. I'm happy to do that. I love answering your questions. There are no bad questions. The questions I get in response to this show give me ideas for what I should cover on the next show so that they know what people are curious about. And I do talks every month in my office now, the first Wednesday of every month at 6 p.m. Check my website for upcoming topics. We're getting more and more people showing up for these. Over the past few months, I've done talks on toxins, hypothyroidism, diabetes, heart disease, huge turnout for that, hormones, and a whole host of other conditions. I'd love to be able to meet you in person and answer your questions and those of your family and friends. Thank you for tuning in. Have a fantastic weekend.
You've been listening to Safe, Effective Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Tune in every Friday at 2 p.m. and Saturdays at 3:30 p.m. for safe, effective natural solutions right here on 98.3 FM, The Word.